Hey, Tilman Vonderland here, and I'm going to talk to you today about some lower back pain and some self-massage techniques that you can use to help remedy that. Okay, so what we are talking about today is specifically in the lower back, and here we have a picture of some nerves that exit the spine and they go down and will target the gluteal muscle and then also the gluteus minimus and create some pressure for you down at the side of the back here, like, or back of the leg, right? Now, it also runs here and it can go into the front of the pelvis here in this area, okay? So that's the name of the nerve, and those are the pathways. So yeah, okay, the nerve exits the spine, but there's some structures there that are also equally important, okay? There's the floating ribs of your rib cage, and then there's also some muscles. Which muscles are those? Awesome. Look, we have here Quadratus lumborum, floating ribs right there. And here we have this muscle here. The X's are trigger points. We're not going to worry about that right now, okay? So we have the crest of the pelvis here. And these are the pain referral patterns right here, you see. Bring this right up close here. Exiting the spine, you get some pressure along through the crest there, down at the side of the hip, and then here as well, in through the front, down along there, in there, and then here, in through over the SI joint, and then also the hip area, okay? So, how are we going to target those things? Well, we have to find them on our body first, okay? So, here we go. I'm going to turn myself around here, and then I'm going to show you, let's landmark here. Why don't you follow me and do this, okay? So, you're going to lie on your side, and you're going to feel for your floating ribs. You can feel them. They're quite palpable. There's the regular ribs that are they'll run across here, but you have two more here that are floating, okay? You find those, great. And then you also know where your spine is, and then you find the crest of the pelvis. And there it is there. It goes quite high. It's actually quite amazing how close in proximity it is to the floating ribs. Look at that. Just a small little area between there, okay? But that expands through this area on towards the spine, okay? So it's about that big of a muscle, really small, right? But for its size, it can really create a lot of pain. So what you're going to do here is you're going to use your thumb. Now you can probably go to a therapist and they'll dig around in it, which is fine, but there's a component in there that's missing. And I want to talk to you about that. Therapeutic stretching might be a term that you want to use for it. It involves movement of the leg or rotation of the spine a little bit to facilitate the stretch on the muscle. And how you're going to do that is you're going to use your thumb as a stylus, and I'm going to do several passes running from the upper portion here over the floating ribs, following down consecutively down to the crest of the hip and then over into the gluteals where they attach to the hip. It's here, okay? So here we go. Fingers towards the spine, okay? Very easy. You put your hand on your back here. Your thumb is already in a position there where it can start, okay? Now bring your knee up a little bit, put your foot on the table, knee up, and what you're going to do is while you are stretching, you're also going to move your leg down. Let the knee fall down, and you'll find a gentle stretch on the muscle underneath your thumb, okay? Using the thumb as a stylus. Now you can glide with your thumb as well, like this. If you're not getting as much of a stretch, then how about bringing your knee over, or your foot over your knee, and then stretching across. And that's even more of a stretch. Okay? Very simple. Do that several times. Now I'm keeping my foot on the table here. You can actually let the foot slide off if you want, and that will even create a little bit more of a rotative stretch on that muscle. And what's also happening here is because your foot is dropping, the hip is slightly cavitating downwards. It's moving down so that this whole area here is causing a stretch to the muscle as well. But you've got your thumb on it and you're creating a stylus or facilitating a stretch on that muscle specifically for that area. Okay, do that several times. Oh, what a relief it is. Okay, now I'm getting some muscle or nerve twinges. They're running up the spine here or up the back and also down into the hips. So I want to try and work here with the muscle attachments at the hip. Same way, fingers to the spine, and you're using your thumb as a stylus, and then just allow the knee to roll down. Oh, a big stretch there. And apply your thumb right over the SI joint. And seriously, you can do this while you're lying on the floor or on your bed. Now, you don't have to dig hard here, that's for sure. There's just a little bit amount of pressure. Now, how much pressure am I using? Really? Hardly any. Okay? And if I wanted to show you, I'm using, if I use my forearm, it's about that much pressure. Very small. Okay? Not a lot. You don't have to really mash your thumb into there, right? Just a little bit. If you want to use the fingernail as an added tool, as a stylus, go right ahead, because the nerves will really respond to that. In a positive way, of course. So if you go to a massage therapist and complain that, hey man, you're using your fingernail, you should cut your fingernails, they're too long. Watch for the eye rolls when they say, oh man, you have no idea, right? I'm using my fingernail as a stylus to affect neurological response on the muscle. So you try that. You can use the palm or the fleshy part of your thumb and use the edge of your nail and check out the difference, the huge difference. Okay. Oh man. And again, look at the amount of pressure I'm using. Hardly anything. Okay. If I wanted to apply or describe it as a pound percentage, I don't know. How much is that? That's, oh gosh. Maybe 2 ounces, 3 ounces of pressure. Hardly anything. Okay, so try that. Okay? Self-massage technique for the lower back. Until next time, take care. Bye for now.